Cancer is a blooming public health issue. Breast cancer, it is very common because clearly it is one of the most common cancer, not only in India but also in the world. Cervix cancer was the most common cancer in India in females, but now it is number 2. This number 2 is because of enhanced screening, pap smear testing, what test every woman should do regularly. Let us discuss about this in this video. Hello everyone, I am Dr. Pooja Babbar, Consultant Medical Oncology at CK Birla Hospital, Gurgaon. So, what is the most important thing regarding our health? Cancer is a blooming public health issue. Even WHO has named cancer as a top 10 public health issue in 2023. So, the most important risk to our health is cancer. So, is there any test a woman can do to come to know about her risk of developing cancer? Yes, there are screening tests. So let us start with what are the common cancers in female. The most common cancer, as you all know, is a breast cancer. Then we have cervix cancer, ovarian cancer. So for breast cancer, it is very common, and now this screening test is widely available. Lot of knowledge is regarding how to screen the breast cancer because clearly it is one of the most common cancer, not in India, not only in India but also in the world. So the simplest screening test is doing mammography. What is mammography? It is an X-ray of your breast that has to be done either yearly or 2 yearly after the age of 40 years. And before the age of 40 years, if you have any symptoms related to the breast, like breast pain, swelling, any lump or any redness, any itching on the skin, any nipple related problem like discharge and itching, you should consult a doctor, either an oncologist, gynecologist or breast surgeon, and get yourself checked. And before the age of 40 years, we do breast ultrasound instead of mammography to limit the exposure to radiation. One more important aspect is doing clinical breast examination and self-breast examination. Self-breast examination every female should do because if we know about our breast, self-breast examination every female should do, and this should start early, probably at the age of 21 to 25 years, and it should be monthly in the lying down position while bathing and in the standing position, and also get yourself checked by a healthcare professional, and if any problem is there, get breast ultrasound. Now, there are certain females who have a family history of breast cancer, first degree relative like mother, sister, or some female closely related by blood. In that particular case, you need to meet a healthcare professional, discuss about enhanced screening, because then you fall under high risk and your chances of developing breast cancer is more than any average woman. That screening has to be initiated early, and that screening incorporates 2 screening tests instead of 1, like MRI or breast ultrasound or mammography staggered at 6 months. Coming to the second common malignancy in female, cervix cancer. Now, cervix cancer, most common symptom is, pervaginal bleeding. Now, earlier cervix cancer was the most common cancer in India in females, but now it is number 2. This number 2 is because of enhanced screening, pap smear testing, and also because of HPV vaccination. So for this cancer, women need to be screened with either pap smear testing or HPV DNA testing. The ideal age to screen a woman for cervix cancer or for the presence of HPV DNA is 21 years. And by the female is at the age of 30 years, we can incorporate HPV DNA. So in simple words, age 21 years, get your pap smear done every 3 years and get your HPV DNA done every 5 years, after the age of 30 years, and also you can do both the tests once in every 5 years. If there is any lesion, any suspicion, then the gynecologist will recommend any excision procedure so that this pre-malignant condition should not progress to cancer. Coming to the third cancer, it is ovarian malignancy. Now, ovarian cancer, lot of females are aware about breast and cervix. Very less female know about ovarian cancer. It is the most lethal cancer. Two-thirds of patients present at advanced stage, either stage 3 and 4. Because the problem is in early stages, we don't come to know about the symptoms. Like breast, the most common symptom is a painless lump. Cervix, most common symptom is a pervaginal bleeding. But ovarian, we don't know what are the common symptoms. So I will tell you a symptom index. Whenever any female who is post 50 years of age, do not ignore these symptoms. If you have gastritis, if you have abdominal pain, if you have difficulty in eating, or you feel full after eating, if you have urinary complaints, frequent urination, if you have constipation for a long time, altered bowel habits, if you have bloating, if you feel your abdomen is growing in the size, do consult your doctor and get CA-125 blood test and ultrasound transvaginal to know the status of your ovary. Though this screening test is not recommended, but any female who feels suspicious of these symptoms should visit the doctor, get these tests done. Thank you so much.